Hi friends, I think you might have seen my earlier videos on obesity, endoscopic bariatric and sleeve gastrectomy. So this will be a brief video on Roux-en-Y gastric bypass, a type of bariatric surgical procedure, probably one of very popular bariatric surgical procedures around the world. This was first introduced in the year 1978 by this famous surgeon who's believed to be the father of bariatric surgery, called Professor Edward Mason. Of course, the surgery procedure has evolved in multiple stages to what we do today, but then it has stood the test of time probably to be the bariatric surgical procedure with the longest history, and long-term benefits have been proven beyond doubt in multiple hundreds of scientific literature. So what is done is, unlike in a sleeve gastrectomy that you might have seen where a portion of the stomach is trimmed and taken away, here there is nothing that's actually removed out. A small gastric pouch is created by using a stapler. We make a small pouch of about 50 to 60 ml or so by dividing the stomach like an L. The smaller pouch, which is called the micro pouch, now needs to empty food, because when you eat food, it's going to come into this micro pouch. So a small portion of the intestine called the duodenum and the jejunum is bypassed. Then the intestine is divided. Then that divided intestine or the jejunum is brought up and joined to this micro pouch. And then further down, about 100 centimeters down, the intestines will again be rejoined. So that the food will come into this micro pouch from the food pipe, then go down into this jejunum, and the stomach, the remnant stomach or the bigger portion of the stomach, which produces acid, and further down in the duodenum is where the biliary juices and the pancreatic juices join. They all come down and then join this jejunum later down. So the digestion and the absorption takes place there, and then they go down what is called the common channel. Oh wow, this looks too complicated. No, it is not that complicated. Yes, it might look so comparing the sleeve gastrectomy, but it's a reasonably simpler procedure, especially in expertise hands. It takes only about 45 minutes to 60 minutes to complete the procedure. And with this usage of a stapler, these can be done without much complications.